Hello, my name is Anish Gupta. We're over here at Lyon Dental Implants and Oral Surgery. It's our private practice here. We specialize in implants in addition to other oral surgery procedures. Today we're here to talk about Grant. He is someone I've known for a long time. We went to middle school and high school together. We played on our middle school football team together, and he had contacted me not that long ago saying that he's having some trouble with his teeth. He had seen some other dentists. He had a rough idea of what needed to be done, and he had some family members who had had implants as well. So he kind of had a good understanding of what was involved and what he needed. And he came to talk to me, and we figured out, hey, we need to do something so that we can get him some new teeth.
Hi, I'm Grant. I'm looking forward to get a new smile from Dr. Gupta.
Super excited about this case. Grant Nichols has been a friend of mine since middle school, and he talked to me, said, hey, I need some help with my teeth. Came on in for a consultation. We took a look at things. One of the things he mentioned to me was that someone had told him years ago that he might need to get a denture, and unfortunately that's not a great option for someone young, someone who's going to be forward facing, someone who wants some stability with their teeth. So we talked about an implant supported solution for him. A lot of people call this solution the all-on-4, which means that we're going to put a full set of teeth on 4 implants. And in our case, we're planning on doing 6 implants. I call those extra 2 implants spare tires, so that we're going to get him a set of teeth that will fit on those 6 implants, that he can walk out of here the same day of surgery and have teeth that he can smile with and show the world. The way this kind of works is something like this. These are Grant's teeth here. We did some rough estimations of where we want to plan his teeth. And in this video here, we've got 6 implants. The teeth that he'll be getting will be 3D printed here in the office. We use an outside lab to design. We colorize them in-house, and so he gets a set of teeth like this that he can walk out of here with. There won't be any more broken teeth in his mouth. There won't be any more painful teeth. There won't be any other missing spaces or gaps in there, and he'll have what most people would consider a very nice smile afterwards. The implants take about 3 months to heal. After those implants get done healing, we go ahead and switch them over to something like this. This is a ceramic or a zirconia arch here. These have a lot more heft to them. He'll be able to bite into apples, eat corn on the cob. He'll be able to smile without worrying that his denture is loose or that it's moving, or when he's talking that he's lisping or anything like that. And so we're giving him the best smile that he can have with the technology that we have.
So me and Dr. Gupta played football in middle school. His praise of the game is he won the scoring touchdown to go 6-0 as city champs. So I've known Dr. Gupta for probably 20 plus years, and I've didn't feel comfortable with coming to anyone else just because I struggle with my teeth, and it's not something that you necessarily want to go to anyone because it's embarrassing. So the reason I came to him was because of my teeth, and there's a lot going on in my mouth right now. So the issues I'm having, to be honest, all stems from addiction. With my addiction, I've lost all my teeth. I don't have any in my backs, I don't have any in my tops, and it's not always fun to just explain that to someone of why you don't have teeth. It's an embarrassing thing. I can't smile, I can't eat. It's just not easy for me right now. Every meal is very difficult to eat. It depends on what it is, soft or if it's hard. I have to chew on one side or chew on the other, and to be honest, also is tooth pain. I have tooth pain all the time, and if you've ever had tooth pain, it is the most excruciating pain to have.
So this procedure's been around for about 25, 26 years. One of the challenges that we used to have in the past with it was that if the temporary breaks, if a screw breaks, it becomes a huge headache because you basically have to start from scratch and make the set of teeth all over again. One of the things that we do in the digital era is that we are able to scan his current teeth. We're able to scan his temporary teeth that we make. We have a designer who makes this in a lab and then can send that over to us, just a file, and then we can actually print it. So that's something that'll take us, 15 to 25 minutes to print, and then a couple more minutes to, colorize to make it look more natural. The nice thing about that is that if you do have a broken temporary, if you do have something like that, we can literally replace it in that period of time. Usually by the next day we'll have everything ready, as opposed to in the past that would take, anywhere from 3 days to a week to make a new set of teeth. But as anybody would know, if you had a broken front tooth or were without teeth, it might be tough to go to work or go to school or smile for your family. One of the other things too that we use is something called photogrammetry, which is a fancy way of saying that, hey, we can actually connect all those implants on a digital scale with super good accuracy, but we're talking like 5 microns, so a very small amount. A human hair is roughly 100 to 300 microns, so much more resolution than even that. And the nice thing about that is that we just don't see the temporaries break as much. We don't see these screws break as much because everything is so precision fit. The last thing we do, we have obviously a 3-dimensional x-ray. We do other things that we can take like a 3-dimensional face in case we need to line up teeth with your nose or your eyes and things like that. The technology is all there to help support the surgery itself. So we have good sound surgical principles, and then we have all these tools that we use just to make it so that there's less headaches on the back end and that things go smoothly from A to Z.
I didn't want to deal with a dentist. I didn't want to deal with any of that because it's so embarrassing. I went to a dentist probably, I don't know, 7 years ago, and I was like, I don't even want to open my mouth. That's what my biggest concern was, just opening my mouth and someone seeing what's inside of it, because it's disgusting. Knowing Dr. Gupta personally, I felt more calm, more relaxed, even though it's still embarrassing, especially when he took my x-rays and I had to look at it. There's been nothing but calmness here, nothing but gratefulness, and nothing but love, to be honest. The whole staff too. Everyone's treated me like I'm their own. So I've truly anticipated this for a very long time.
This is one of the bigger procedures that we do. It's not heart surgery, but as far as a dental procedure goes, it's probably bigger than getting wisdom teeth taken out. If you were to buy a book from Amazon or Barnes & Noble, that's the same book there as it is online. When it comes down to something like healthcare, not all surgeons are the same, not all offices are the same, not all staff are the same. You know, we really pride ourselves in the hospitality that we have, the smile that we put on our faces, the fact that you're taken care of from A to Z, that you'll get a phone call afterwards, that all the paperwork can be filled out ahead of time, that all your prescriptions will be sent out ahead of time. We take pride in the fact that we have all the technology available to make the surgery go as smooth as possible, that we have invested in these fancy cameras and these fancy tools that'll make it so that the lab can help us make something, the 3D printer that we can print in-house, so that if something does break or go wrong, that, hey, we have a solution for you, that we have a plan B for you. The challenges for a procedure like this is that it is one of our bigger procedures and everything matters. Things have to be precision placed and precision fit. I get caught up in the surgery side of things since I do the surgery side. And you can put implants anywhere. It's actually a pretty easy thing to do, is to put screws in drywall. But the more important part, and the part that all our patients care about, is where the teeth come out from, because that's where you're smiling, that's where you're chewing from. And so it's really important that we have all those measurements taken ahead of time. The famous carpentry phrase is measure twice, cut once. And with all of our technology, with our team, the fact that we've done this over and over, we measure 3 or 4 times before we actually do the surgery.
To have a smile and to eat normally, that is the biggest thing. Like, we take for granted in life what we have, like a driver's license, like our teeth. If you don't have those types of things, you should be grateful, because if you don't have them, life sucks. Every day is a blessing. So my life right now is looking great, and I think after this it'll be even better. I'm not going to say it's going to be substantially better, but it's going to make me feel internally better.
This is by far my favorite procedure to do, not because it's necessarily the most fun, but because it gets the best result. We all started out saying we wanted to go into healthcare and go into dental school because we want to help people out. A common phrase that you'll hear dentists say is that we love to create smiles. And I've learned that over the course of my career, dentists aren't necessarily loved, and a lot of the stuff that dentists do is stuff that's not creating smiles, it's fixing problems, there's cavities, there's gum disease. This is one of the procedures that we get to do where somebody starts at point A and then we end at point Z, and it's transformative. People's lives are changed. People don't even realize sometimes it's not just, you know, chewing or smiling, but it's being able to look into a camera and smile at your family gathering and not have to worry which side you're looking out of, or how big you have to smile, or putting your hand in front of your face because you're not thinking about, you know, what are people looking at. And so I love the fact that we give people confidence in their smile. We get their ability to chew their favorite foods again, eat their steaks and their pistachios. We love that part of this.
So this entire procedure has been, to be honest, pretty amazing. The overall process from the beginning of walking in the door and then walking out the door, it's been absolutely amazing, especially from the surgery part of it. Like, I was in and out within 4 hours, and it just, everything that has been going on here has been absolutely amazing.
Thankfully, this case wasn't, particularly complex. I think for me, the part that makes things challenging is if it's somebody and somebody that you will see later on. It's one of those things that this is not just another case. This is somebody that we're gonna continue to have a relationship with. It's somebody that I'm gonna see online. It's somebody that's gonna come to our open houses and things like that, and that we're gonna shake hands with. And so it is, technically it wasn't challenging. He had the ability to get implants. His teeth weren't particularly curvy or difficult to extract, but at the end of the day, we want to get a result that we can be proud of, 5 years from now, 10 years from now, 30 years from now. Given the story that he came in with, the history that he told me about, especially the toothaches, multiple of his teeth were broken down. Given that multiple of his most critical teeth, the ones that hold the arch intact, were gone or broken, we did know that he was going to unfortunately have to lose those upper teeth. We planned on extracting all of his upper teeth. We planned on putting in multiple dental implants for him. You do well what you do often. And thankfully, dental implants and extractions are what we do often. So a lifetime ago, I would have said that this would have been a very challenging case. Today, this was something that was a little bit more routine. And despite saying something like that, we still had to make sure we did a good job with it.
For 3 days, my whole face was numb. I couldn't feel anything, which was amazing, because after the fact, it was not fun, because your gums are brand new to your teeth being pulled and all that. And it wasn't a fun situation, but I can't say that if I didn't have them doing it and giving me what they gave me, I'd go through this process all over again. Honestly, it was a lot easier than what I thought. Like, they told me 2 weeks, and usually when you have surgery, they say 2 weeks and it lasts a couple of months. It literally was 2 weeks and I was done, and all the pain subsided, all the swelling subsided, and everything just went on like normal. I was terrified. Not gonna lie, I would go to any doctor over coming to a dentist or oral hygienist or whatever you may call it, because I want no one to touch my mouth because the pain is so bad. But I can say this, you're in comfort, you're in care here, and they do an absolutely amazing job. And that's hard for me to say, because I wouldn't go to a dentist over anything, because I just hated coming to a dentist. But here you're comforted, you feel great, and they do great work.
For any kind of dental implant case that we do, we kind of have a set baseline of things that we need. So we'll get the patient to come in, we'll take photos. Spend a lot of time on records. We can spend up to 3 hours with a patient just to make sure that we've got every single measurement, from the tip of his nose to the tip of his chin to the shape of the teeth that he currently has, to how big his smile is and what shows when he smiles and how far his lip moves. So we spend a lot of time. We do general photography. We also do have a 3D camera that'll take a picture of your face, and then we can kind of manipulate it, or the lab can look at it, so it doesn't have to be a physical person there. For planning purposes, we'll take a 3-dimensional x-ray, so that's called a cone beam CT. We do that on every single patient who is a candidate for implants. We can see the bone not just in 2 dimensions, we can look at it from every single angle. And we also do intraoral scans. So in the past, we would have taken impression with some of that goopy material, and now we can do that with a camera as well. Now we take all of that information, we put it all together, whether it's on a computer, whether it's having a conversation with his lab, and then we can say, hey, this is where the teeth need to be, and now that we know where the teeth need to be, now we know where the implants need to be. So it's a top-down approach. That's kind of the most reliable way of doing things, so you get a result which does stand the test of time. This wasn't a technically guided surgery in the sense that we didn't have specific stents or splints that go in that says implants have to go here. But the things that we did use that made this easier is that we did digitally plan this case on the computer with his CT scan, so with this 3-dimensional x-ray. With that plan, we're able to transmit that to the lab so that they could design the teeth. Some of the tools that we used during the surgery to make this easier, and which helps us not need guides for this kind of case, is that we use things called photogrammetry. So we've got these dominoes that go in there and can give the 3-dimensional position of the implants in space. And so it's very easy for the lab to use that information and then create temporary teeth. One of the challenges we had during this case too is that Grant ended up moving up north, so he was further away from us, and something happened up north where something broke while he was eating some food, but he was able to come back down over here, and by the time he drove down here, we had a new set of teeth 3D printed for him, and were able to deliver it right away. So even though he was far away, and that creates some challenges with making sure that we can keep an eye on things, we were able to turn around things pretty fast, and even though this complication of things breaking on him happened, we're still able to get him a good result in a timely fashion.
Weirdly enough, like when they go in and they do, like they switch your teeth out, like I'm waiting for pain. Every single time I get a nudge, every single time they put a screw in, like I'm waiting for pain. So I don't have that anymore. So it's very weird to me, but again, amazing.
These are big surgeries for us. They're big surgeries for our patients as well. So we kind of block them out during the day. We don't really have other patients coming in at that time. So for Grant, he was the only patient here for that chunk of the day. He comes on in, we'd give him some medication so that he was a little bit more comfortable, less anxious about the whole procedure. We did get him off to sleep completely. Dr. Stanzik was in on the case as well here, so we can have one team member doing the surgery, one team member doing the anesthesia. Amber is our surgical assistant who deals with a lot of the planning for these types of cases. She's the one who will talk to the lab, design the case with them. She'll swap out temporaries with patients. She'll put the final teeth in as well. She helps with a lot of the on the side, making sure all the instruments are in the room. Sean will be my surgical assistant for the case. She'll be the side-by-side person, making sure everything's clean and clear and that we have everything ready for the actual procedure itself. And then we usually have a couple other people, in this case Ashley, helping out to make sure that if we need to get something else in the middle of the case, that she can run and go get it, and she's just an extra set of hands during that as well. Surprisingly, you don't think the front desk team is involved in these as well, but they kind of make sure everything else is communicated well, and communication is huge for these types of cases. So Amber may call out to Catherine or Sammy or Carrie up front, and they'll go ahead and call the lab if we need something. They'll ask the lab if we can get something back faster, confirm that they got all the emails that we sent them, the text messages, the photos, all that stuff. Because during the case, there's just a ton of coordination. We'll get an intraoral scan, send that off to the lab. They'll design something. Then we'll take those domino scans, send that off to the lab. They can then modify things as necessary. So these types of cases involve a lot of communication, and there's a lot of team members involved.
From the day that you walk in the doors, you're welcome, you're greeted, you feel like you're at home. And then from the dental hygienist to the doctors, everyone is there for you and everyone works together. I've had everyone in here work on me, and I can have no complaints, and 1000% I would recommend Lyon dental implants. I've actually had a lot of friends that have reached out to me to get referrals for Dr. Gupta. He does amazing work. Like I said, from the beginning, when you walk in the door and when you walk out the door, it's 100% professionalism, and they care. And that's the biggest thing for me, is that the care comes with it. They're a team and they work as a team, and I would highly recommend them out of anyone.
The reason I got into this type of surgery in the first place is that if you asked me 20 years ago why I went to dental school, I would have said, I want to, help people smile. I want to make a difference. Unfortunately, somewhere along the way, you lose track of that. It turns into, I've got 3 fillings, an extraction, and a crown today, and you lose that sense of, why you're doing this in the first place. So I got into this full mouth rehabilitation because when I see patients get that done, whether it was at another office or my friends, sharing their stories, it brought back a lot of that, hey, we're here to help people. And so at the end of the day, my success is going to be based on how happy the patient is. And a lot of times that's based on, hey, did the smile work out? Did the teeth work out? And so again, if you're working backwards from that, how do you get there? So there's all these people involved. There's all this record taking involved. There's a lot of technology involved. But at the end of the day, I know I've succeeded is, hey, my patient's smiling at the end and they're happy with that smile. We know we succeeded on the day of surgery is when Grant walks out of here with teeth, And so that's a pretty amazing feeling to have. And even today, our goal is to say, hey, did we get him teeth that were perfect for him, that fit his face, that he can go ahead and chew with and eat with, and that the highest compliment I can get is that he doesn't even realize he's got fake teeth inside of his mouth. You get that, sense of pride. You can get teared up. I mean, when patients have a great outcome that takes their breath away, that's amazing. Do we get that every single time? No. But at the same time, there's plenty of times and enough times for me where somebody gets their teeth and it's totally more than what they were expecting. They may have been like a dental cripple, or they may have had dentures and they weren't working out, and now they know that they can go ahead and smile in public. They can go to parties, they can take photos of having this, turned to one side. They can smile with a full smile instead of closing their lips together. They can go ahead and eat the foods that they want, have macadamia nuts or popcorn if they haven't had it in, years or decades. And that's kind of what we're going for. We're trying to, rehabilitate smile. We're trying to reclaim smiles, and that's what we're going for.
Waking up with a brand new smile was difficult for me because I wasn't used to it. I was used to seeing something that I wasn't happy with, but like looking in the mirror and seeing a smile changed the whole ball game for me. It was a different aspect on life because I didn't smile for years, and it just changed my whole game. So looking in the mirror and being able to smile, even though it's still to this day difficult me to actually smile because I'm not used to it. But overall, like, I love it. I delayed it for years and years and years, and the biggest recommendation I can give is just get it done, because the longer that you keep going, the longer it gets worse. And the tooth pain, I mean, don't delay it, just do it. I know it's hard because it was hard for me. It probably took me 10 years to actually reach out to Dr. Gupta, but I'm glad that I did. Thanks, Dr. Gupta, and to your practice.